Fatigue related to chemotherapy and radiation, either together and or whether people are receiving chemotherapy separately from radiation, is very, very common. Upwards to 80 to 90% of people report feeling very tired when they receive chemotherapy and or radiation. There are different reasons for this. One primary reason is the chemotherapy itself, and it depends on which type of chemotherapy you're getting. The second cause of fatigue can be the cancer that's being treated and the degree of cancer or the extent of cancer that one has. Also associated with that is the question of whether or not one has had surgery, whether one is anemic, whether one is underweight, whether one is able to eat and drink properly. All of these things can contribute to one feeling pretty tired and worn out. The experience of fatigue itself can be quite variable depending on the individual. Sometimes it comes on suddenly, sometimes it's a slower process after having received chemotherapy over several cycles. In any event, what becomes extraordinarily important for the person who is feeling this tired is A, to understand that it absolutely can be a part of the treatment. It's not something that you are bringing upon yourself. But it's to recognize it and to also recognize you have some control over this. So the following recommendations have emerged over a period of time based on people's reported experience and based on research, and they are pretty much as follows. 1, eat and drink as much as you can, and dependent, of course, on your type of cancer, but it is important to have adequate nutrition and adequate hydration. People who do not take in enough food and who do not take in enough liquid will report fatigue independent of whether or not they're even receiving chemotherapy. Secondly, it's important that if you have pain or other side effects from the chemotherapy and or radiation, that those are addressed as well. Pain that is not controlled can have a very wearing and gnawing nature, and people will be fatigued just because of that. The other thing that becomes important, and in fact it's the only thing that has really been proven to be effective in helping with fatigue related to chemotherapy, is some form of exercise. Most people will tell you that they absolutely do not feel like getting out of their chair, getting off the couch, getting out of the bed because they just feel so tired. In fact, the people who are able to do that within a timely manner and in a reasonable way actually will feel quite a bit better. You start out slow. Some people it's only 5 minutes walk a day. Some people it's just a walk around their house. If you start to feel better, then you gradually ramp that up and you can do 10-minute walk, 15-minute walk. For some people, it's just a matter of doing their daily activities, washing dishes, walking around outside, but it is the one thing that has been documented to make people feel quite a bit better. I should also say that there is one other piece of fatigue which people experience, and that can be a degree of depression, or if it's not depression, stress and some other things. And this psychic stress can be really debilitating when it's tied in together with tiredness associated with the chemotherapy. So it becomes pretty important to try to also take care of any sort of underlying sadness, depression, and other stress that one might have.